Hello, today we're going to be reviewing the Nutrition 101 class, Bariatric Surgery Nutrition Basics. Today we'll discuss everything you need to know about nutrition before and after surgery, including overview of different types of surgeries, basic nutrition habits, macronutrient and protein shake information, portion sizes, how to incorporate physical activity and movement into your daily routine, and a little bit about what to expect after surgery. Really important first to talk about the fact that bariatric surgery is a process. You all are probably very aware that surgery is not an easy way out or a quick fix. In order to be successful, you must dedicate yourself to lifestyle changes and continue those changes for a lifetime in order to be successful. It is important that you work through the program and complete the recommended visits, clearances, and education classes. All of this is structured and set up to help you be successful long after surgery. A lot of what you have to complete before surgery is insurance driven. It's important that you meet the criteria set by your insurance plan so that you get approved for surgery when the time comes. In addition to the pre-op work, bariatric surgery is also a lifetime of follow-up care. Once you become a bariatric patient, you're a patient forever. So it's really important that you continue those follow-ups as scheduled in order to stay on track and help you stay successful. Bariatric surgery is a life-changing decision, and those lifelong behavior changes are required. A lot of those changes come in the form of nutritional differences in behaviors. The foods and beverages that you choose every day, the serving sizes of those choices, and then having general awareness about what you put in your mouth every day. It's amazing how many food decisions we make and never realize it. But to be successful with weight loss and changing your health, you do have to be very aware of not just what choices you're making, but why you're also making those decisions. Another part of life after bariatric surgery is vitamin and mineral replacement. You will have to take vitamins and minerals every day for the rest of your life after surgery to ensure your body is getting the nutrients that it needs. And in addition to all of this, it is important that you learn how to move your body. Whether it's a little bit or a lot, it is important that you start to establish an activity routine to help you stay as healthy and successful as possible. And that's something that we'll talk more about throughout this class. First, I want to talk about some pre-op nutrition basics. These are the basic habits that are really important you start to take hold of, to start incorporating into your life now. That way, when surgery rolls around, you are able to just implement relatively easy after the procedure. The first thing is we really want to prioritize protein. Eating a high protein diet is going to be important after surgery. So in order to prioritize that, we recommend you eat your protein first. So for example, if you're eating grilled chicken and mashed potatoes and green beans, we want you to eat as much of that chicken on your plate first as possible. Then eat your green beans and save those mashed potatoes for last. It is important that you're choosing foods that are naturally low in fat and low in sugar. So avoiding added sugar, avoiding fried foods, keeping the ingredients in a more simplified fashion is going to help achieve this. It is important to be a good drinker. Staying hydrated is really important, not just now, but definitely after surgery. So try to master the art of sipping on fluid gradually through the day because you're going to need that habit after surgery. Another habit to break is drinking when you eat your meals. After bariatric surgery, you really need to prioritize food at meal times because you're not going to have enough space to eat and drink at the same time. Drinking a lot during a meal can also change the consistency of your stomach contents, leading to some digestive issues for some people. So try to leave about 30 minutes between finishing a meal before you start really drinking a lot of fluids again. Caffeine and alcohol can be consumed after surgery but should be limited, so please just follow your surgeon's directions on this. For the most part, we recommend no more than about 150 to 200 milligrams of caffeine per day and maybe one drink per day or just on special occasions. Eating on a schedule is important. After surgery, your stomach size will be limited, so you can't just save it all up and eat everything you need in a day at one time, because you don't have space for that. So I encourage you to eat at a consistent time throughout the day while you're awake to ensure you're fueling your body the proper way. Eating slowly is also important. It should take you about 20 minutes to finish a full meal. Any more or less than that can affect your digestion. Something that I will show you in a moment is the MyPlate method of setting up your meals. This is a really great basic tool to use to stay on track without having to always count and measure or weigh everything that you're doing. Also really important to, again, raise that awareness about what you're eating is to keep a food diary or a food log. Unless you're writing it down and holding yourself accountable, it's really easy to lose track of the bites and licks and tastes that you're taking every day. But writing it down can really open your eyes and bring a lot of awareness. So I encourage you to start keeping that food log, start taking a really big look at what you're doing, and not just what, but why. Another really important thing to remember, and I want you all to grasp this and carry it with you forever, is that the small steps that you can take and become consistent with can mean huge changes in the future. Got to take it one step at a time. I love to use soda as an example for this. Let's say someone's drinking 4 sodas per day. We cut out 1 per day, which doesn't seem like much, but that's about 200 calories per day that someone has now cut out of their diet. By the end of the week, that's 1,400 calories. By the end of the month, that's almost 6,000 calories saved just from reducing 1 soda per day. So it doesn't mean you have to start and wake up tomorrow and change everything that you're doing, but identify a couple of small habits that you can modify and try to do those on repeat, and eventually the benefits will start to pay off. Next, I want to talk about the macronutrients. Macronutrients are the big pieces of our food. It's where our calories come from. So it's important to understand this so we know how our body is achieving fuel. So we're going to talk about each of these individually: protein, carbohydrate, and fat. Protein is up first, and protein is the foundation of our body, kind of like the foundation of your house that holds everything together. Now, and moving forward, protein is the most important part of your meals, and for very good reason. Protein supports the production of new cells and tissues in your body, provides strength for your muscles, which is incredibly important, especially during periods of very rapid weight loss, and helps support the overall healing process as well. We get protein from a variety of sources, primarily animal-based sources. So if it ever had a mother, it's going to be a high protein food. But in addition to that, things like tofu, soy products, certain types of grains, and lentils can also provide protein if you follow a more plant-based diet. Protein shakes are another source of nutrition to get that protein. Protein shakes are an easy way to get 20 or 30 grams in a drink form. You will be needing to drink protein shakes for your prep and then for your recovery after surgery. I really encourage you to start thinking about protein shakes now, finding something that you like, and maybe replacing 1 meal per day with those to start encouraging and getting used to that change. In those protein shakes, we encourage a whey or whey isolate protein, 20 to 30 grams of protein per serving, less than 5 grams of fat and sugar. So here's a few examples. Doesn't mean you have to stick with the ones here, but these are easy to find at the grocery store. The bariatric supplement companies also have lots of options and unique flavors available on their websites. Whether it's a ready-to-drink shake or it's a powder that you're mixing with liquid of some kind, any is fine, as long as it works for you and your lifestyle and your budget. On the nutrition label, protein is down at the bottom. So if you see that red arrow there, it's pointing to the protein section. Your goals for protein are at least 80 grams per day. Try to work in a protein source at each meal, and eat protein foods first on your plate. The second macronutrient is carbohydrate. These are a primary energy source. Now, I know carbohydrates get a really bad reputation in the world of weight loss, but our body truly does need them. It's like putting gas in the car. But do most of us eat too many carbs every day or maybe choose not so nutritious options? Absolutely. So the type of carbohydrate you choose does make a big difference. We really want to focus on carbohydrates that are complex. They contain fiber, things like whole grains, non-starchy vegetables. These complex carbohydrates have fiber. They digest more slowly. They're going to cause a slower rise and fall to your blood sugar, and they tend to have more nutritional value. Whereas simple carbohydrates have a lower fiber content, they do digest very quickly and tend to have a spike and a fall to your blood sugar, are typically less nutritious as far as vitamins and mineral content. And a lot of these processed carbohydrates have added sugar, which is something that really needs to be avoided as much as possible. So when it comes to choosing the right foods, again, we want to focus on those complex carbs. So things like vegetables, fruits, low sugar dairy products, whole grains like brown rice, whole grain bread and pasta options versus the more refined versions. Less often do we want to be picking those other choices like the white rices and pasta, sugar sweetened fruit products, sugar sweetened dairy products, starchy vegetables, sugary cereals, chips, desserts, sweets, ice cream, etc. Again, we want to keep the added sugar as low as possible. It's not that you can never choose these items, it's just that we should be choosing the more nutritious options most of the time. On the label, carbohydrates are located just above fat, or just above protein. So you see several different pieces of information here. You're going to see total carbohydrate, you're going to see fiber, sugar, and added sugar. The most important thing for you to pay attention to is the added sugar option. We want to keep that as low as possible most of the time. Basic goals surrounding carbohydrates would be maybe 100 to 150 grams per day preoperatively. Again, choosing those healthier, more nutritious options and making the higher carbohydrate foods kind of the smallest portion on your plate. After surgery, that carbohydrate does decrease because we need a higher portion of your diet coming from protein. So fewer carbohydrates after surgery, but still able to eat them even on a daily basis. The third and final macronutrient is fat. Across the board, a low-fat diet is recommended, but we do still need to get some fat from our foods. Again, just like carbohydrate, the type of fat makes a very big difference. So unsaturated fat is our healthy fats. They are plant-based sources and are always going to be liquid at room temperature. These types of fats are actually required by our body to function, and they can help reduce inflammation or potentially cholesterol. Sources of those are things like your cooking oils, nuts and seeds, avocados, and then cold water fish, because the fish eat a diet very high in plants that contain these fats. And then we eat the fish and we reap the benefits of their nutritious diet. Saturated fat is found in animal sources. So anytime you're eating a protein or a dairy product, you're going to be consuming some saturated fat, and that's okay. The goal is not zero, but the goal is to avoid excess. These are going to be solid at room temperature. So think about butter. It's always solid unless we heat it. It may get soft, but it never liquefies unless we heat it past a certain temperature. Too much of these fats could lead to increased inflammation or cholesterol levels. Not always, and it does take a pretty significant amount to see that change. But again, we still want to avoid adding extra when we can. Fat is listed up at the top of the nutrition label. You're going to be able to identify the types of fats in the food from the label. But again, at the end of the day, the takeaway is to avoid extra. So if you can cut down on the amount of butter or oil you're using in a food, if you can pick a grilled instead of a fried option, swaps and choices like that are going to help you reduce that overall fat content. So when we put these pieces together, it brings us to the bariatric plate. So on that plate, we want half of our plate to be protein, most of the rest of it to be a low carb or hopefully a vegetable most of the time, and then keep the carbohydrates to the smallest portion on the plate. Another way to do this is to use your hand, because we always have our hands with us. So imagine your meal fitting into the size of your hand. Protein goes on your palm, veggies go on your fingers, and then keep the carbohydrates in this space between your thumb and your forefinger. It's a really easy way to kind of put these pieces together without having to count and track and measure everything that you do. Measuring and tracking is the most accurate way to hold yourself accountable, but maybe not always the most realistic. So feel free to use these other tools if you need to as well. When it comes to fluid intake, after surgery, again, we are going to ask you to avoid carbonation. The bubbles are very hard for you to digest, and it's not recommended. Liquid calories of any kind, unless it's a protein shake, really need to try to be avoided. Calories from liquids like soda, coffee drinks, energy drinks add up very quickly. It is not uncommon to see people drinking 1,000 or more calories per day and not really even thinking about it. It can really affect weight loss. When I see patients struggling with any weight regain or weight loss issues after surgery, a lot of times it's related to liquid calories sneaking back into their choices. We may ask you to avoid caffeine and alcohol for a period of time after surgery. Again, this isn't a forever thing, but never should they be consumed in excess. The goal at the end of the day is about 64 to maybe up to 100 ounces of liquid a day, based on your hydration needs, what you do for a living, if you're exercising, etc. But at a bare minimum, about 64 ounces per day. Earlier in the session, I talked about activity and movement. Our goal for you now is to establish a habit. I know some of you may have some moving restrictions. You may have limitations due to pain, movement, ability, etc. But do what you can. Literally anything counts. Whether it's walking or using a recumbent bicycle, maybe you do chair exercises or do some upper body work with resistance bands. Just start a habit. Try to find something that you enjoy doing and try to do it for at least a few minutes, 5 days a week. Regular activity after surgery is going to help maintain your muscle mass and help improve your skin integrity, to hopefully reduce the impact of excess skin after surgery. Next, I want to talk about nutrition after surgery. Your diet will advance in stages to allow your body the time it needs to heal. You will start on clear liquids immediately after surgery and quickly transition to full liquids the day after your procedure. You will continue full liquids for 2 weeks until you start soft food. You will continue soft food for 2 weeks and then start regular textured foods about 1 month after surgery. You will receive handouts and guidance about the specifics of these stages as needed, so be sure to continue those follow-up appointments so your surgery team can guide you through this process after surgery. There are some nutritional side effects that are important to be aware of. Dumping syndrome can occur particularly after gastric bypass surgery. The good news is it can be avoided, but keeping your sugar intake and sometimes fat intake to a minimum is going to prevent this dumping syndrome from being triggered. Fat malabsorption just comes with the territory of having switch procedures done, so a low-fat diet is going to be necessary after this procedure. Some short-term bowel changes should be expected, maybe diarrhea, maybe constipation, but neither should be long-term. If you're having ongoing issues with this, please ask your registered dietitian or your surgeon for assistance so we can get to the bottom of why these things are occurring. And then with reflux, typically bariatric surgery may help improve those symptoms. But if you never had reflux before and start experiencing it, or if you've had reflux and symptoms get worse, again, please let your bariatric surgeon know so they can address why this is occurring and help you resolve that issue. When it comes to vitamins and minerals after surgery, we want to keep it as simple as possible. Most patients just need a bariatric multivitamin with additional calcium. Other vitamins are just as needed based on what the lab work tells us. Be sure, again, you're communicating with your bariatric surgeon, with the dietitian that you're working with before surgery to find the vitamin that is best for you and your needs. There's lots of options out there, but remember, the plan can look very simple. You do not have to take handfuls of supplements every day. Quick and easy is the way to go as long as you're choosing high quality supplementation. And finally, just remember that this whole process, this whole transformation starts right now. Surgery is an amazing tool to help you achieve your goals and sustain them, but you have to put that work in to change your lifestyle and your behaviors. Surgery is a tool, but it doesn't fix the mindset. You have to do that work for yourself. Make sure you surround yourself with a support system. There may be some rough days ahead. It's really important you have some people to lean on that understand what you're going through. And then finally, remember that now is the time to start making changes. Maybe you want to use that bariatric plate to help set up your meals, to provide some consistency. Maybe you do drink a lot of sugar in your drinks, so you need time to slowly wean yourself down from that. Maybe you don't really know where to start, so you're going to start keeping a food log just to become aware of the choices you are making through the day. Remember that nicotine and bariatric surgery are a no-no. They do not go together, so if you're a nicotine user, you must stop before surgery. Or maybe activity is something that you struggle with and you need to add a little bit more into your life. So maybe you want to take some of those tips and tricks and find a couple ways to start moving your body a little more than you did before. But whatever it is, remember to start slow, go slow, make changes over time. The more work you can do now before you have surgery, the higher likelihood you're going to have an easier, successful recovery afterwards.